Sharon, I think you gave
Good
the
morning.
host to the wrong person.
Yes. Okay, folks, it's 10 o'clock, and with that in mind, we would begin the meeting. And so I will invite Mrs. Helen Royer to provide the welcome remarks at this time.
Thank you very much. Good morning, Dr. Bender and colleagues. Okay, Dr. Benjamin Proutas, Unit Chief, Human Resources for Health, members of the Commission representing member states, partners, agencies, and regional institutions. Good morning. Permit me to extend a warm welcome to you on behalf of the Secretary General of CARICOM, Dr. Carla Barnett, to the 4th meeting of the Caribbean Commission for Human Resources for Health. Today, as the Commission meets the important and essential work of CCHR in addressing the issues that the Caribbean community faces with human resources for health continues. Sorry. It must be remembered that human resources for health remains a key pillar for the operationalization of responsive and resilient health systems in the Caribbean. As you know, CARICOM celebrates its 50th year as a community, and in recognition of this, on the 6th of July 2023, at the heads of government meetings held in Trinidad and Tobago, it was decided that free movement for all CARICOM nationals must be a reality by March 2024. This decision goes beyond the existing CARICOM Single Market and Economy Agreement, and it is an indication for free movement. And it is an indication of the renewed commitment to realizing core regional integration. Furthermore, the decision considers access to contingent rights that should be afforded to CARICOM nationals in their movement, including primary and emergency healthcare and education, along with hassle-free travel. For the CCHR, consideration must be given to the impact of this decision in determining how education and practice of healthcare professionals, nationally and regionally, can promote the free movement of skilled professionals in the region. Sorry, I think I'm having some disruption here. This offers the unique opportunity to accelerate efforts for the standardization of education and practice of the healthcare professionals in the region, and to develop innovative cross-border initiatives that could potentially stem health worker shortages at a national and regional level. Today's meeting will provide, among many other matters, updates on implementation of policy briefs, vaccine hesitancy, and status of immunization among adults and children, and opportunities for training of healthcare workers under the WHO Catholic Fund. May your deliberations be fruitful. At this time, I wish to recognize the continued partnership of the team at the Pan American Health Organization, the representatives from partner organizations, institutions, and commissions who are also supporting this initiative through technical support. Special mention must also be made of the Caribbean Public Health Agency, the University of the West Indies, the University of Guyana, the World Health Organization, the Dalhousie University, and the Regional Nursing Body. Finally, I wish to acknowledge the focal points from member states who continue to be committed to improving the strategic management of the human resources for health in the region, and in supporting the development of resilient health systems that provide quality health services. I wish you a productive day. Thank you.
Thank you, Mrs. Royer, for those remarks. At this time, I want to just acknowledge that we have a few persons who have entered the meeting. And so before we move to the next agenda, I will ask...
Dr. Bender, I just wanted you to excuse me. As you know, I'm attending another meeting, and I am very sorry. In a nice, noisy environment, I didn't have time to go back to my room. So I'm going to excuse myself, and I wish you all the best.
Thank you so much, Mrs. Royer.
Bye-bye.
Bye-bye. So at this time, we give Mrs. Royer a chance to depart. And with that, we'll move to the next agenda item, which would be opening remarks by Dr. Benjamin Puertas. Dr. Puertas, are you online?
Good morning to everyone, and thank you very much for the words of Dr. Rogers. So I am very happy to be with you this morning, and this is the fourth meeting of the HRH Caribbean Commission. My greetings to Ms. Bell, the chair of the meeting, and to all of the delegates and participants that are sharing today this time to discuss some very important items regarding the development and strengthening of human resources for health in the Caribbean. As you all know, the Pan American Health Organization is committed to supporting the Commission and the countries to improve and strengthen the human resources for health and the capacity building in the region. Mr. Dean Chambliss, the director of the regional program for the Caribbean, he's following up closely, and we talk frequently about the different advances within the region, and in particularly now that we have already funding to implement some activities regarding human resources for health in the Caribbean. So again, my thanks to all of you, and the Pan American Health Organization will be always ready to support these efforts. Thank you very much, and back to you.
Thank you, Dr. Puertas. And with that, we move to the next agenda item, and which will be followed by the chair's remarks and roll call. Thank you so much. Over to the chair, Ms. Lizette Bell.
Good morning, everyone. I would like to welcome each and every one of you to the fourth HRH Commission meeting. I also would like to thank Dr. Puertas for his continued engagement with the Commission and the Pan American Health Organization in helping us, the Caribbean, to move this initiative forward. We'd also like to thank at this moment Ms. Royer for her welcoming remarks this morning. And with that said, we'd like to proceed with the agenda item, which is item number 4. We can go through the agenda, and if there is any item that any person would like to add, they could make the addition at this moment. Oh, sorry, I think
Chair,
Dr. Bender would like to do the roll call first.
Yes,
Please go ahead, Dr. Bender, sorry.
Thank you, Chair. So at this time, we'll just take a very quick roll call to determine who is in the meeting with us this morning. So we'll start with our member states, and I will ask if anyone from Antigua and Barbuda is present in the meeting.
Yes, good morning. Margaret Smith, Chief Nursing Officer, Ministry of Health, Antigua and Barbuda, present.
Thank you. The Bahamas?
Present. Good morning, Dr. Shrita Moxie, Ministry of Health and Wellness, Bahamas.
Thank you. Barbados?
Good morning. Present, Ms. Stacey Goring, Chief Health Planner, Ministry of Health and Wellness, Barbados.
Thank you. With that, we move to Dominica. Belize.
Lisette Bell, Chief Nursing Officer, Belize.
Thank you. We move to Dominica.
Good morning, Florestine Luis, Principal Nursing Officer, Acting, Dominica.
Thank you. We move on to Grenada.
Good morning, Nesta Edwards, Chief Nursing Officer, Ministry of Health, Wellness and Religious Affairs, Grenada.
Thank you. We move on to Guyana.
Good morning, Odessa Wickham, Director Acting, Georgetown Public Hospital.
Thank you very much. We move to Jamaica. Okay, if there's no one on the line from Jamaica, we move to Montserrat. If there's no one from Montserrat, we move to St. Kitts and Nevis.
Good morning, Violet Brown, Montserrat.
Oh,
I'm
I'm so
reporting
sorry.
acting director of nursing. I'm sorry, I just couldn't get the mic on.
All right, thank you, Montserrat.
You're welcome.
St. Kitts and Nevis.
Hi, good morning. Kishma Fenston Nesbitt, Administrative Officer with responsibility for HR for the Ministry of Health.
Thank you very much. St. Lucia. Okay, if there's no one on the line from St. Lucia, we move to St. Vincent and the Grenadines. Okay, we move on to Suriname.
Morning, Wesley Williams from the Ministry of Health, Suriname.
Thank you. We move on to Trinidad and Tobago. Okay, is there anyone from Anguilla? Okay, Bermuda. The British Virgin Islands.
Good morning, Jacinth Hannibal from the British Virgin Islands, Chief Nursing Officer, the Ministry of Health and Social Development.
Thank you. Cayman Islands. Turks and Caicos Islands. Okay, and with this we move to the organizations, and so we start with CARFA. Is there anyone representing CARFA on the line today?
Yes, good morning, everyone. Dr. Mark Sami, Director of Corporate Services. Thank you.
Thank you very much. We move on to PAHO WHO.
Yes, I have to say, well, I'm here representing the Pan American Health Organization. We have also Ms. Fiona Harris Glenville, who is also representing the sub-regional program from PAHO based in Barbados. And we'll have in a few minutes Martha Belandia representing the immunization unit, and she will be reporting on one of the policy actions regarding vaccine hesitancy among healthcare workers. We have also Dr. Cecilia Acuña, who is part of my team in Washington, who is our person in charge of the policy in human resources for health. And we will be discussing one of the mandates from the last COSOT meeting regarding the preparing the policy brief on healthcare workers migration in the Caribbean. And I don't think I'm missing anyone else from the PAHO team. Thank you, and over to you.
Thank you, Dr. Portes. Do we have any representatives from Dalhousie University?
Yes, present.
Thank you, Ms. Rigby. University of Guyana. I'm sorry, of the West Indies. To repeat, is there any representative from the University of the West Indies? Ms. Mix, I see you're online and your mic is open. I'm not sure if you're having mic trouble. Could you confirm in the chat?
I think she's writing in the chat if we can double check.
Yes, I see Ms. Meeks, Professor Meeks is representing University of West Indies, Jamaica campus online. She's having some mic trouble. Thank you for the confirmation. And we move on to the University of Guyana. Okay, for the regional nursing body. Ms. Nesta Edwards.
Yes, I would just like to say that Ms. Edwards, Nesta Edwards, Chief Nursing Officer, Grenada, is also the chair of the regional nursing body. So I guess I'll represent the regional nursing body as well.
Thank you so much. We would ask if there's anyone from WHO online. I believe Dr. Bustamante had expressed her regrets in not being able to attend. I don't think there's anyone else online from WHO. So we move to the next off person. That would be the Sakarium Secretariat. And from our part, you would have received the welcome remarks from Mrs. Helen Royer, who is the Director of Human Development here at the Directorate of Human and Social Development in the CARICOM Secretariat. I am also with you, the Serena Bender-Pelswick, the Deputy Program Manager of the Health Sector Development Desk. And with me today is Ms. Geeta Jailal and Sharon C. Prasad, who are our administrative support on the call, as well as, yes, that's it. Thank you so much. And that completes the roll call from our end. We hand over to the chair.
Thank you, Dr. Bender. So we can proceed as the agenda. If there is any other item that you would like to add to this particular agenda today, if there is no other item, then can we accept the agenda as is presented? Can we have two members accept the agenda, please?
CARICOM moves to adopt the agenda. Thank you.
Thank you.
The Bahamas seconds.
Thank you very much, Bahamas. Okay, this meeting this morning is scheduled for 2 hours. I believe that we should be able to finish by 12 p.m. If not, then throughout the meeting, we will update you if we would need maybe an additional 15 minutes. So we could move to the agenda item number 6, which is the update on action points from the third meeting of the HRH Commission, which will be presented by Ms. Bender with support from PAHO. Kindly proceed, Dr. Bender.
Thank you, Chair. So the first update item would be 6.1, the development of the policy brief on the mobility of healthcare workers in the region. And with this, I would ask Dr. Puertas to provide the update on this action point.
Thank you very much, Madam Chair, and thank you very much, Dr. Serena. As you know, we presented in the last COSOT meeting the preliminary results of the study on mobility and migration of healthcare workers in the Caribbean. This is an effort that was supported by our colleagues from University of West Indies in Trinidad and Tobago. We had some difficulties in analyzing some data because we didn't receive all the data that we were expecting, especially the quantitative component. So as we mentioned to all of you, we had to incorporate a qualitative component as well. So we carried out some interviews to complement the information that we have obtained. So now we have a more final report, that's supporting our effort to identify a consultant to carry out and to start working on the policy brief that again was a mandate from the Ministers of Health during the last COSOT meeting. So what I suggest is that we could share that what is I would say final version of the report to all of you for feedback. And then we can consolidate the last version, and so we can have the document ready for distribution. But meanwhile, my suggestion is that we keep it within the commission, so we get the feedback, especially from those delegates of the countries that presented data and information. Again, the challenges that we see in the region is the data information, and that goes very much with building and strengthening the health information systems, especially in human resources for health, which is another agenda item. But I think some countries and some of you who were involved were witness to that difficulty in gathering data to be able to have a more robust analysis and study. So still, I think the evidence is very important to be able to build this policy brief with policy actions that will focus on controlling this challenge that the region has in terms of migration of healthcare workers. I think we have very important information and new information to share. I think we still have gaps in terms of data, as I already mentioned, but that's the way we have, and that's another reason why we need to strengthen our health systems, health information systems. As we did with the previous policy briefs in the past, the evidence allows us to work on the policy brief, and then with policy actions that need to be implemented, and that's something that we will also discuss during this meeting. We have completed the terms of reference for this consultant that's going to prepare the draft policy brief. My suggestion, as we did in the last time, is to have a draft shared with the Commission and all the delegates and participants to be able to discuss and to have a presentation actually here in one of our meetings, then to have the document to be analyzed and discussed. We got very good feedback from delegates and members of in those days, the Action Task Force. And we were able to put together and consolidate those comments, edits into one final document that was presented to COSOT. Ministers approved it and mandated the implementation of those policy actions. And that's where we are now with the previous two policy briefs. So my suggestion is to follow a similar procedure, to have the consultant working on the policy brief draft, to present it to the Commission, to the Commission, to receive the feedback both during the meeting and written, to consolidate the final version, and then to present it to next COSOT meeting so we get feedback from the ministers too. And also something that I was talking to CARICOM about, if you have any candidates who could be part of this work, some candidates to be the consultants to work on the policy brief, we will be very happy to receive names and CVs, because this is a very important effort. That's what I had to say about this particular agenda item. And if you have any questions, I'll be happy to respond. And here we have Dr. Cecilia Acuña, who has been working together with me in the development of these terms of reference that we will be happy to share with all of you. Over to you.
Thank you very much, Dr. Puertas. Just one question. When do we expect to have the draft of the study share with the countries that participated for feedback?
Thank you very much, Ms. Bell. I would say that by next week, we could send the version we have at the moment. So you can look at it and read it and share and comment. Still is not the final version because we still need to do some additional analysis, but I think we have a much more robust document to share with you. So if you agree, by next week, we could share what we got now.
Okay, thank you very much, Dr. Puertas. We have Ms. Moxley, please go ahead.
Thank you, Chair Dr. Moxley here from Ministry of Health. Dr. Puertas, thank you for the update. Just two questions regarding the consultancy that you mentioned. What is the timeline for submitting to PAHO? To whom should we submit? And is there a document that you can share with us that outlines the competencies, capacities that you're looking for in the consultant? And will this consultancy be a team of consultants or just one? So that we, as we search within our pool, we can submit more than one if that is required. Thank you very much.
Thank you very much, Dr. Moxie, and very good questions. We would be working with one consultant, and and if that consultant needs or wants to work with an additional person, that's up to that person to decide. We shared the terms of references with CARICOM, so probably it's ready to be shared with all of you whenever you consider appropriate. I would say soon as possible. And so yes, the terms of reference are with CARICOM already, and also the request to provide names and candidates to participate in this consultancy. The time frame as soon as possible too, because I think we were ready to start as soon as we got the person and we complete the hiring process at PAHO. So we would think that in the next 2-3 months we would have hopefully in 2 months the draft of the policy brief to present to the Commission and advance in that sense. I hope that answers your questions. Over to you.
Thank you, Dr. Puertas, you did.
Thank you very much, Dr. Puertas, for the presentation. If there is no other question or comment, I don't see any other hand up. Okay, we can proceed to the next item, 6.2, which is harmonization of midwifery training curriculum in the Caribbean, and we'll get an update from Dr. Bender.
Hello, good morning again, all. As it relates to harmonization of the midwifery program, we all know that this is something that comes as part of the Caribbean community's agenda in terms of standardizing the skills of healthcare professionals within the region. And recently, within the 50th meeting of the regional nursing body, which was held here in Guyana on the July 18 to 20, this agenda item would have appeared where there was a statement made on harmonization of the midwifery curricula, considering that the body is currently revising the standards for nursing education and nursing and midwifery practice. So as part of the statement, a number of actions were outlined on what the harmonization intended to do. And with that, the body intends or is in the process of drafting a position paper with a terms of reference that would seek then support of the Pan American Health Organization in defining how they would move forward with the harmonization of the midwifery program. So with this, it can be expected that perhaps this statement may be put forward to this commission in future for consideration. And that is, once the statement is completed, I'll be so guided by the chair of the R&B, it may be shared with this commission, and that is the completion of the update.
Thank you, Dr. Bender. Is there any comment, any questions? I am not sure if the chair of the R&B, sure, please go ahead, Ms. Smith.
Good morning. So I am the immediate past chair, not the current chair. But just to add to what Dr. Bender just mentioned, that it was also mentioned at that meeting that we had already made contact with PAHO prior to that meeting and already engaged with PAHO with respect to the support that PAHO promised to provide the R&B. And so the discussion, the dialogue continues. I think that there will be a meeting on Friday. The current chair can bear me out on that. And yes, that terms of reference that Dr. Bender Pelswick mentioned will be, once it is ready, will be presented to the officials from PAHO. But we are already engaging PAHO with respect to the support that will be provided to the R&B with respect to this particular item. Over. Thank you.
Thank you very much, CNO Smith, for your contribution and update. Okay, so if there is no other comment or question related to item 6.2, we can proceed to item 7, which is the update on the catalytic fund and opportunities for training of nurses, which will be presented to us by PAHO WHO.
Sorry about that, I was with the microphone off. Thank you very much, Madam Chair, and I'm going to share a slide so you can see the main elements that the WHO Catalytic Fund is covering in the Caribbean. So allow me just 1 second. Yeah, just to make sure that you can see the slide. As a brief background, the Pan American Health Organization and the Minister of Guyana advocated with Dr. Tedros, the director of the World Health Organization, some months ago, actually in last year, to support some activities regarding the strengthening of human resources for health in the Caribbean. There were several reasons why it was so important. We mentioned already the migration of healthcare workers, some initiatives that Guyana is having in terms of strengthening the HRH in the country. And additionally, we had an initiative established by the Biden administration. This is the US government, and presented during the last summit of leaders in the Americas in June 2022. And this was the America's Health Core initiative that had the objective of training 500,000 health professionals in the Americas to be prepared for the next sanitary emergency or pandemic. So this also supported this initiative started by the Caribbean and PAHO. And finally, we received some funding from the World Health Organization that we call the WHO Catalytic Fund. As you can see in the slide, we have 4 main components for this initiative. The first one has to do with identifying national public health education and training needs and capacity in the Caribbean. The second one has to do with increase the capacity for health worker education and training. The number 3 is establish the HRH policy and regulatory infrastructure to support the expanded education and practice of health workers throughout the subregion. This is the Caribbean. And finally, use communications to enhance project visibility. So each of these components has some specific actions, and I will just report on the most important ones and those that we have already initiated. This project is it has a duration of 2 years. So we have a first tranche of fundings arriving just in the past month, and those are we need to implement in this year, 2023. So talking about the number 1, identify national public health education and training needs and capacity, we have initiated with one activity that has to do with strengthening health, human resources for health information systems, and the platform that I understand some or most of you are familiar with, which are the National Health Workforce Accounts. So what we need to do is to do a mapping of the health workforce, a mapping of strategic actors, and to evaluate the maturity of the health, the human resource for health information systems. So that's the first action, and in next September 11 to 14, we will have a big meeting in Panama All the countries that are represented here in the Commission have been invited to send their delegates and focal points to the NHWA platform. And we will be having this first workshop on maturity of HRH health information systems. We will do the beginning of this mapping of the health workforce in the Americas. So I really invite all of you to, invitations have been sent to nominate the delegate and to send that person to this meeting that we consider is going to be very important. We'll have delegates from ministers of health of Latin America and the Caribbean, and we have in two phases. The first one will be for Latin America in Spanish, from Monday 11th of September to 13, yes, and then we have the meeting with the Caribbean delegations and in English. So this is something that we really want to invite all the countries to participate, because we have been experiences difficulties in improving our health information systems, especially in HRH, and this is a good moment to start working on it. As you will recall, also the Caribbean identified a set of core indicators. So that's a very good experience that's going to be shared with the rest of Latin America. And after the Caribbean experience, the Latin American region is also following the same steps of identifying indicators that they consider the most relevant to their own needs. These are HRH indicators. And during this meeting in Panama, they will be validating those indicators. That's a process. We did it as you will remember, as an HRH action task force in the past. So that's good to know that the Caribbean has some experiences to share, good experiences to share, and lessons learned to other countries in the continent. So that's something that's going on. But this particular component has other elements that has to do with an assessment of national education capacity. And also that's something that, as you remember, the Caribbean did already. Remember that we, as a action task force, identified all the relevant academic programs in the Caribbean with a description of the courses and components, contents in terms of human resources for health and other. So we went from even starting in the pre-grad programs as nursing, medicine, pharmacy, odontology, up to master's and doctoral programs. So we have that document which is in the process of being published. So we also have something very important already advanced in this term, in this capacity. Something else that with the Action Task Force, as you will remember, in the past it was presented by Dr. Juana Paola Bustamante, and some countries were very interested in pursuing, and that is the health labor market analysis. So that's something we will also do in November. We will have the first workshop with countries from South America, and early next year we'll have the workshop with countries from the Caribbean. So this is something that we will be doing, the health labor market analysis in selected countries as part of this component number 1. If we move to number 2, increase the capacity for health worker education and training. We're working together with PAHO's Virtual Campus for Public Health in developing a HRH webpage portal linked to the Caribbean node of the Virtual Campus. So that's something that we will be also having a workshop in September, again in Panama, in terms of strengthening this portal. We also want to develop the content to address training needs in the Caribbean, and we're going to focus on learning pathways, focused on primary healthcare competencies. We will work with the countries in courses on specialized areas of primary healthcare and essential public health functions. We will also develop an executive leadership course in health governance and public administration. And something that we need to work with the Commission relates to micro-credentials for course completion. So that's something that we need to think probably for next year. And of course, part of this component number 2 is the leverage expert knowledge of regional universities and academic centers and existing knowledge networks. That's why it's so important to have the University of West Indies, and we really hope that for next meetings, the University of Guyana will be sharing these meetings, in particular because the WHO Catalytic Fund has some specific funding for Guyana, taking into consideration that the Minister, Anthony Frank, was key in the discussions that finally, and the advocacy to obtain this funding. So that's why University of Guyana is important to be part of these meetings. In terms of this work with Guyana, I want to go a bit further, because the reason why Guyana is key in this particular point is because, as you know, they are doing a strong effort to increase nursing education in this country. And since now we got this funding, what we have been doing is adding nursing tutors in nursing education from other countries to the already planned and ongoing activities organized by Guyana. In particularly, Guyana has been working in training of nursing tutors with one of our PAHO collaborating centers, which is University of Ribeirão Preto in Brazil. So we have been supporting Guyana in the last couple of months. But now we're going to have a training, inside training in Brazil for nurses, tutors, 15 nurses from Guyana. These are tutors of the nursing school. And what we did is, since now we have this funding, we invited five nurses from other countries, probably you know at the moment, and they are going to be joining this 15-day training in Brazil with the Guyanese tutors. And that's the way we're aligning something that Guyana has already started with the needs of nursing education in other countries in the Caribbean. In particularly, this training, which starts in September, will focus on simulation labs. So that's very good, because as you will recall, we, as PAHO, we started this pilot on strengthening nursing education in the Caribbean, in Turks and Caicos, Belize, and Dominica. So this is a very good continuation, because when we analyzed this situation, all the countries had needs of tutors and mentors for nursing education. So number 3 has to do with establish the HRH policy and regulatory infrastructure. So in this case, we want to expand the role of regulation and training of nurses in primary healthcare in the Caribbean with support of the regional nursing body. So in this case, we have been already meeting with the regional nursing body, with nursing associations, and that's something we really want to talk, the expanding role of nursing in the Caribbean. We also need to expand the virtual education. So we need to identify standards for registration, the initial competency of graduates of online programs. So, you know, during the pandemic, this was the way that really expanded virtual education, but now we need to think about how to ensure the quality of this virtual education, how to increase the literacy of tutors of virtual education, and the standards for registration. So this is something that falls under this category, and we have some activities regarding this. And the last one has to do with just to be able to report, communicate, to be able to develop videos of highlights of the project, develop infographics, publish social media posts. So we make it visible, to, especially considering that this is a funding that comes from WHO, who will want this visibility as well. Questions that you may have regarding this catalytic fund. Over to you.
Thank you very much, Dr. Puertas, for that presentation. And definitely, we look forward to the health labor market analysis study. It is very important for the region and for us to really know our the health labor market. And this also helps us with further HRH planning and interventions. We have Dr. Fiona with her hand raised. Please go ahead.
Thank you, Ms. Bell. My name is Fiona Harris Glenville. I am working with the virtual campus. I just wanted to add something to what Dr. Puertas said with regards to the strengthening of nursing education in the Caribbean. We've already started to engage the UWI Caville campus in developing a program that will be extended towards nursing tutors in building competencies in use of simulation and in virtual training. So we've already started work on that. So we're engaging UE Caville with. So at some point, we will need some of you to give some input into what needs to be included as part of the course, and also to be engaged in utilizing the course on the virtual campus. Thank you.
Thank you, Dr. Glenville. CNO Smith.
Thank you, Madam Chair, and thank you, Dr. Puertas, for that presentation. I just have one question, though, with respect to the catalytic fund that you just mentioned, and the meeting of chief nursing officers and R&B at that meeting in I think it's to be held in Chicago in November. Does this fall within that? And who are the, is this specific countries who will be invited to that meeting, or will each CNO from the region will be extended an invitation? Because as far as I've learned so far, not too many persons have received an invitation. Over, thank you.
Thank you very much for the comments. Thank you, Dr. Fiona, also for bringing up some advancements in terms of nursing education. Thank you, Dr. Margaret. The invitations were sent to all the countries in the Caribbean. I have to double check with Dr. Silvia Cassiani, because as you know, this is an event that will be covering some very important elements, and yes, it's completely related to what we are proposing here in this as part of this funding. I just want to mention too that the catalytic fund is not something that comes isolated. We aligned it with our priorities. We align it with our indicators and outputs and outcomes, the same as WHO did. So that's why it took a bit of a time to come to this final agreement with our colleagues from WHO. And the example of the activity in Chicago, it's you know, it's important because that's how we were able to link some priorities. for in this case, for the Caribbean with the funding. I'm trying to find some more details, but the reason why we do it in Chicago, that's another question, because, you know, it was raised by actually within PAHO, why we don't do this activity in the Caribbean. And the reason is because we are obtaining some logistic support from University of Illinois at Chicago, the nursing program. So it will reduce costs since they will provide for some logistics in terms of space that we don't need to worry about. That's the reason why we do it in Chicago, because it's organized together with one of our collaborating centers, which is the University of Illinois at Chicago. That's something that I wanted to share, and I will follow with Dr. Silvia Cassiani, because the invitations were sent a while ago, and we're waiting still for confirmation from some of the countries. So actually, I take advantage of this opportunity to invite those countries that received this invitation, and to be able to confirm who is going to be participating in this activity. Over to you.
Okay, thank you, Dr. Puertas, for the clarification. So if there is no other comment or questions in relation to the catalytic fund, we can now proceed to item 8, immunization in the region and vaccine hesitancy among adults and children. This will be presented to us by PAHO WHO.
Good morning, everyone. I share my screen. No, this screen. Just 2 seconds again. I'm sharing my screen. Are you able to see my screen?
Yes.
That the one with the presentation?
Yes, health workers and vaccination.
Perfect. Thank you. Thank you very much. I have 3 screens. So.
We're not viewing it in slideshow format, though. We're seeing it from the file end.
Yeah, I changed it. You know, this is hard when you have like 3 screens. Okay, let me try again. Sorry about that. I think I'll do in the easy way, if I can. And I share again.
Probably you have to click at the bottom for the presentation mode.
Yes, but when I do that, it appears in another screen, and I am not able to bring this screen to the one that I'm sharing. Okay, let's do that in this way. Okay, let me do that in this way. Okay, think now. Wow, almost. Okay, so thank you very much for giving us the opportunity to present this project that we are doing between the Comprehensive Immunization Program, the Human Resources for Health Unit, and the Caribbean Subregional Office, with the objective to monitor the trends of vaccine hesitancy among healthcare workers in the Caribbean. As you know, in May 2021, we conduct a study in 14 countries in the Caribbean, and we found that 23% of the respondents display some level of vaccine hesitancy, and primarily nurses. But the thing with this project, with this first study, is that the results help us to promote vaccines and acceptance among healthcare workers, including communication strategies targeting specific human resources for health categories and age groups. And also we develop a policy through the HRH Action Task Force and CARICOM Ministers of Health. In 2021, during the 41 COSOT, was approved this policy addressing COVID-19 vaccine hesitancy among healthcare workers. And this policy action number 1 that is systematically monitor drivers of COVID-19 vaccine acceptance among healthcare workers. So taking in consideration that we have this mandate to monitor these drivers of a COVID-19 vaccine, we are proposing a follow-up study. So the main objective of this follow-up study is to analyze and understand comparable trends over time to improve implementation strategies and tailor communication approach on vaccines in the Caribbean, with 3 main objectives. The first one is to understand the influence of the pandemic on the knowledge, attitude, and practice among healthcare workers in the Caribbean. And here we have one change. Now we are moving from COVID to the entire program towards all the routine vaccines that the Caribbean is applying. The second objective is compare trends, as I mentioned, in knowledge, attitudes, and practices, and gather and analyze information that help us to promote better immunization practice in the Caribbean countries. We are inviting 13 countries of the Caribbean to participate in this follow-up study. And the main criteria of inclusion is to be a healthcare workers. And here you can see all the different categories that we are including again in this follow-up study. The sample size, we are looking forward having 760 healthcare workers of the Caribbean. And here you can see the different proportion by countries. We are using the similar instrument that we use in the first study. And as I mentioned, the main difference is now that we are moving from COVID to all vaccines in general. And the other main difference is that right now we have the vaccine. So the question regarding acceptance or not the vaccines is if the healthcare worker already received the COVID-19 vaccine. Additionally, we are looking to obtain more information on how the healthcare workers are looking for information regarding vaccines. We want the different key stakeholders to promote the study. We want ministries of health, health organization, universities, professional college, professional association, private institution to promote the study. The idea is we are distributing links and QR codes for people to fill out the survey. And here we are using at the same as last year this snowball technique for everyone to want to participate could do that. Here we have the timeline. At this moment, we are doing the pilot study, and then we have to submit this for approval to our PAHO Ethical Review Committee. We are waiting to launch the survey on the first week of October and starting processing results at the end of November for having a report at the end of December. In summary, this follow-up study will provide input to make valuable decisions regarding vaccines and contribute reversing the backslides in vaccination in the entire program of immunization and support countries to improving vaccination strategies. Thank you very much. If you have questions, more than happy to answer.
Thank you very much, Dr. Velandia, for that presentation. With regards to this study, this one continues to only focus on healthcare workers, or it's also a survey that is going to look at the general population?
No, here we want to, thank you for the question. here we are focusing on healthcare workers because we want to, and it was first the policy, as I mentioned, this is the objective of the policy is to improve. Sorry for that. Here we have to. The policy was directed to addressing COVID-19 vaccination among healthcare workers. And that's why we are continue focusing on healthcare workers. Additionally, because as you know, they are the main source of information for the public. So we want to, first of all, to follow up this policy action. And second, we want to continue looking what happened and looking for the trend at the healthcare workers level. But I see Benjamin is raising his hand. Please, Benjamin.
I think the Bahamas had a hand raised before mine.
Sorry.
Please go
Thank
ahead,
you so
Dr.
Yes, thank you so much, Chair, and thank you for that presentation, Martha. Just a quick question. Can you go back to the slide that summarized the sample size?
Yeah, sure. This one.
Yes, my question is, how does this sample size for the follow-up study compare to the sample size for the initial study?
The numbers are very similar. As I mentioned, we want to continue, we want to follow up and see what happened with the trends. So for this reason, the sample size are very similar. And here I want to highlight the importance of this as a monitoring trend for the entire subregion. Probably, as you can see, the numbers are not super high. So we are looking forward to see what is happening in the entire subregion as the first study. So we have results for the subregion, and here we will have again results for the entire subregion.
And so just a follow-up, the same sampling frame then was used for both?
Yes.
Okay,
yes.
Thank you.
Thank you. Benjamin?
Yes, I would add to the question by Bahamas that also the population that you see here is an updated number from compared to the previous sample size. So that that also changes a little bit the proportion of and the sample size number. But of course, if we can get a larger sample size, that's better. I mean, this is just the base to think about. But then, of course, with the larger sample size, it's always better for the power of the study. That's just to complement to what Dr. Belandia said. The other comment I had was regarding the pilot. And this is also following the same process we did in the original study, that we did a pilot just to make sure that the questions and everything was according to the reality of the Caribbean. So for this occasion, we will also do a pilot. And actually, now that we have a very good representation of countries in the Caribbean, I would ask for those countries and the delegates here in this meeting to express their interest in being part of this pilot. And if we can come out with a list of countries that would be interested in participating in this pilot study, which is just to validate the survey, that would be great if we can come out with that list at the end of this meeting. That's what I wanted to add. Over to you, Mark. Thank you.
Thank you very much, Benjamin. Dr. Smith?
Yeah, thank you, Madam Chair, and thank you, Dr. Belandia, for the presentation. I think it's a good study to do, in following up on the first study to see where we're at right now post what people's views are, healthcare workers' views are just a little clarification, because you said now that you'll be looking at routine vaccines. And is it in relation to looking at routine vaccine, is it specifically the healthcare workers' attitude towards routine vaccine, or the general public's attitude to routine vaccine post-COVID?
Thank you very much for the question. Thank you very much for the question. No, it's regarding healthcare workers and their attitudes regarding routine immunization vaccines. We have seen, for example, that influenza it's a vaccine that not all the healthcare workers recommend. So we want to try to identify, we already have information for COVID, but we now want to see what is happening with the other vaccines in the schedule. So we did a similar study in the Latin American region. And now we want to, first of all, as I mentioned, to follow up the trend, but see what is happening with the routine. So it's influenza, another vaccine that healthcare workers don't recommend, and try to identify why. HPV, we are asking regarding HPV. So all the healthcare workers are recommending HPV vaccine. We know that probably for DPT and measles, the attitudes probably are different. But now with these new vaccines, HPV and influenza, we want to try to identify if the sentiment are similar or to the previous one or to COVID. So that's part of the objectives of this project.
Okay, Dr. Velianda, with regards to the pilot study, how many participants are you looking for the pilot study? Because I heard Dr. Puertas mention if countries want to participate in the pilot study. So how many countries would you?
We are looking forward to have like a 3, maximum 4 countries for participating in this pilot, and then like 3 or 4 people from each of this country, because the main idea, the main objective here is just to see if the questionnaire it's clear to understand. But I let Dr. Puertas to complement on this.
Thank you, Dr. Belandia. Yes, that's what we are expecting to have. Not too many countries, the number of participants that Marta mentioned. So to have about 12 to 15 participants that are going to be interviewed. The ideal situation would be to have from different regions within the Caribbean, if that's possible. For example, from ECC countries, from those in the continent, either Guyana or Suriname or Belize, from the north part like Bahamas, I don't know. So that would be a very good combination. So we get responses that cover the full range of diversity within the Caribbean. That would be the recommendation. Thank you.
Okay, thank you for the clarification, Dr. Puertas, and thanks so much to Dr. Velianda for this presentation, and we look forward to continue to participate with this study, because it's only with information and data we are able to do some targeted interventions, because as was presented in the 50th RNB, we note that some countries are still not to pre-pandemic coverage of their routine immunization. So definitely studies like this would help countries to do targeted interventions to go back to their pre-pandemic levels. With regards to the studies, with regards to the pilot study, I would recommend if any country would like to participate, they could kindly note it in the chat, and we will then forward that information to Dr. Puertas via the Secretariat. I noticed Dr. Sami from CARFA has his hand up. Please proceed.
Good morning. Good morning, Chair, and thanks for the presentation. I think it's very important that we determine the reason for this great hesitancy, given that it has an impact on routine immunization as well. I was just wondering if there was a particular reason why we had such a low sample size. According to my calculation, it's about 2% of the total. I know usually we try to target at least 10% or maybe 5% when we're looking at good sample sizes. So I was just wondering if there's a particular reason why it is so low at 2%. Thank you.
Thank you for the question. I think that's very important to highlight the methodology that we did for the previous one and we want to do for this one. So here we have studies with this methodology for sampling. We are not looking forward to obtain representation, statistical representative. So I mean, it's just, we want to know what is happening in general. It's not, we are not able to say with this, as you mentioned, with this sample size, we are not able to say that in Antigua and Barbuda, they have this level of hesitancy. You know, it's not the idea. It's just to have this entire perception looking at what is happening. As I mentioned, the way that we are doing the sample size, the sampling, for example, because the sampling is based on, we are disseminating the QR or the link, and the person who realized the survey is open, and the person who knows and who wants to participate, they could participate. You know, it's not, here we don't have a random sampling. We have, as I mentioned, we have a snowball sampling. We will have quantitative, but also we will have qualitative answers, and the study is more like this mix of analysis. It's not totally representative of any population more than the population that's participating in the study. I don't know if Benjamin wants to complement something here.
No, you said it. Just to remind everyone that the previous study, I'm trying to remember the number that we obtained, but it was much higher than the sample size that we calculated, following the same indications that just Dr. Valencia mentioned. So what we're hoping is to achieve a larger sample size, yes, and probably we will if we have the same response as in the first survey. But the statistical explanation, it's exactly that, you know, not representative, but indicative of what's going on in the region. Over to you.
Yeah, and because we are looking toward having this trend, I think that's more robust, looking at the trends. Thank you.
Great, thank you for the response.
Thank you very much, Dr. Velenda, and we look forward to this study and to participate and to share the survey with our healthcare workers in the different countries. So also thank you all for your comments. If there is no other, we will then proceed to item number 9.
Madam Chair.
Sorry.
Yes, can I just mention that we have already 3 countries that are interested in participating in the pilot. That's written in the chat. That is Dominica, Grenada, and Belize. And I think with that, we have a very good representation of the Caribbean. If we can have an additional country that wants to be part of the pilot, that would be great. So we have already the list of the countries, and then we can approach those countries to so they can suggest the healthcare workers that we can interview. So thank you very much to Dominica, Grenada, and Belize. Over to you, Madam Chair.
Okay, thank you very much, Dr. Puertas. So we proceed to item, sorry, is there any other country? Okay, I notice BVI mentioned they are interested to be a part of the pilot as well. So I believe we have the 4 countries identified for the pilot, and PAHO will be in contact with, I believe, the members of the HRH Commission here for the respective country as we move forward with this pilot study, okay? So we move on to the item number 9, where we look at the progress of implementation of National Health Workforce Account. And the first item here is 9.1, looking at the identification of the focal points. The reason we have this item here on the agenda this morning, it's because we need to be able to have an update from the different countries as it relates to who will be their focal points for the National Health Workforce accounts in country. And also tied into that particular item is also the issue of training that would be required for persons who will be working at country level with the NHWA. So we would like to hear from you as members as it relates to the issue of training. If you would recommend we have general trainings for the entire Caribbean, or if some country have some particular issues that they would like that is peculiar to their country and would prefer focus trainings, because we need to definitely enhance our ability to monitor our human resource for health information and data. And the NHWA is a mechanism that is used for us to do that. And we have noticed that some countries are not updating the information on this platform. So we would like to hear from you this morning if Dr. Puertas or Dr. Bender has any additional information. I noticed Dr. Miss Fiona has her hand up. Please proceed, Miss Fiona.
Thank you very much, Dr. Bell. I put a link in the chat for a form that was sent out by our colleagues at PAHO WHO with regards to the National Health Workforce Account and its use. It was sent on the 3rd of August to the different member states, to the focal points for the NHWA platform. And we would like that you fill it out. What it asks is, what are some of the challenges that we face at the country level? And this is very important, as Ms. Bell just said, that some of the member states have different challenges, and we would like to give some support based on the responses. So I would like that you, if you have not yet filled out that form, we would like that you would fill it out. I also want to bring forward the conversation, bring back what Dr. Puertas was speaking about with regards to the regional workforce on the development of the Human Resources for Health Information Systems, which will be held in Panama from the 13th to the 15th of September. And some of the member states would have already received their invitation. So you would know that we need to, you would have received the invitation, and you would have known if you were invited to attend that workshop. The purpose of the workshop is to address some of the issues that we face with regards to data collection, development of the health information systems, and to give support to countries for strengthening of the human resources for health systems at the regional and global level. And we are looking to identify some countries who can do presentations at that workshop. The purpose is to look at what is present within the Caribbean region. Because remember, it's a workshop that is done for the Caribbean region. So we're looking to look at what is present within the Caribbean region and what we can learn from each other and how we can build on what is already present. So we're looking to identify countries who can present what their health information system is like. It may not, we know that there are challenges with health information systems within the Caribbean, but if there are any countries who have a well-developed health information system or some part that they would like to present, we would be interested in hearing more about your health information systems. We're also looking at those countries who have done a maturity assessment already. If you can share some information with regards to that. And also those who have done mapping of the different occupations within the country and mapping of the actors. How do you identify who is involved with within your human resources for health information system? For example, if you have some linkage with other ministries, with other institutions, and that sort of thing. So these are some of the things that are going to be presented at the workshop, and we are interested in finding countries that are able to do these presentations. So I'm not sure if we can write out the questions that we want countries to identify and send an email through CARICOM so you can identify which presentations you are able to do for the workshop. Thank you. And if you have any questions, I'm open.
Thank you, Ms. Fiona. Yes, I believe we should proceed in that manner as recommended by Ms. Fiona. After the email is sent out with the details of each of the presentation, then countries can indicate their interest in doing any of the 3 topics. Is there any other question for Ms. Fiona? She also discussed 9.3 as well. I noticed the hand is up for CNO Edwards. Please go ahead.
Yes, I am very interested in the national health workforce data. However, at my ministry level, I am not the one to appoint, officers to be trained or to be responsible for inputting data into the national health workforce on platform. I recalled we had 2 officers identified. One has since left the ministry and the other, is engaged in other activities, and it doesn't seem that the data for Grenada is being updated. I would make another appeal to PS to try to identify, the person responsible for human resource and another person to be responsible for inputting data into that national health workforce. It's very important that we have our data into the platform and updated periodically. Thank you.
I notice Ms. Stacy has her hand up. Please proceed.
Good morning. Good morning. Stacy Gorham, Ministry of Health and Wellness, Barbados. I would just like to indicate here, I think I had sent an email time back to GTAL, I think, requesting training for the staff at the Ministry of Health and Wellness. what we would have experienced in terms of the data of the National Health Workforce accounts is that persons I would have gotten training for persons in the personnel department, but those persons would have been transferred to different ministries. So what I had indicated is that I've identified the registration unit, it's a registration council that looks at registration of medical doctors, nurses, and paramedical persons. And I've been trying to get training for members of that unit. I'm thinking that unit is a bit more stable in terms of persons moving, and I would like to have persons in that unit trained specifically so that we can start to update the Barbados stats again. So I'm hoping that we can have a schedule of training prepared, and once I get that schedule, I can submit that to our permanent secretary and make the request for the staff to be made available to conduct the training. So I'm requesting that we can get that training set up, and once we send that information, I should be able to get those staff trained. I think they're a bit more stable. I think the movement will be less, and we can get some consistency in the updating of the information. Thank you.
Thank you, Ms. Growing. That is exactly some of the challenges that many countries are facing in the Caribbean, with high movement of staff being transferred in and out of the different ministries. So the need for continuous training is very important. Dr. Moxley, please proceed.
Thank you so much, Chair. And thanks to PAHO for the update on the NHWA as well as UWI, its intervention. My question is, so first of all, I think the Bahamas certainly would be interested in having a country-specific session on the NHWA. I think we have not yet implemented the NHWA in country. However, we have begun a process to augment human resources for health in the country. And one of the pillars which we are working in is certainly strengthening the information systems for human resources for health. But my question is, what is the recommendation for countries that might have some HR system in place, but wish to capture the features included in the NHWA? How should countries such as those maneuver in the NHWA space? Is the platform interoperable with other information systems, for example, JD Edwards or Oracle? Just a bit about the features of NHWA and its interoperability with other systems, because I think I heard another speaker allude to the fact that even though the NHWA may be implemented in some countries, one of the challenges currently being experienced is that they're not implementing into the system. And so I think what at the outset with the Bahamas seeks to mitigate is the requirement to enter into two systems. So we have a system that is government sanctioned that our HR departments must use. And so we want to ensure that we're optimizing the functionalities of that system such that we are able to capture the necessary data. Thank you very much, and I will close my mic for your response.
Thank you, Dr. Moxley. Can we have a response from a PAHO representative to that particular question, please?
Thank you, Madam Chair. I'm actually writing down the different comments and questions because I think they are very important. I can do it now if you wish. Regarding the first comment, I think, and regarding the experience of Barbados, which I think it was very important for Dr. Stacy to mention that experience, because I remember training a large group of colleagues from Barbados in the NHWA. And when I was talking to Stacy Gordon, it was exactly the same reason that she mentioned. So we want to make sure that from this group, some will stay. So she has given us excellent lessons learned for other countries to consider. And of course, the Pan American Health Organization will be very happy to support any training efforts. And it's the country to decide, if you want to be part of a joint effort of training with other countries, or you have a particular reasons why you want to have a special session of training for the locals. So that's up to the country to decide, and we can adjust our training to those needs. That's regarding this first comment. And also regarding the previous comment on how to, and she was talking something very important, to have both, you have an HRH focal point, and then you have an NHWA focal point. Are those the same people? Is it different? And again, that's up to the country to decide. In some islands that may have limited number of human resources for health or staff to deal with this, it might be the same person, who knows, and that's why it's so important for those countries to decide in who you're going to first delegate, how you're going to do this delegation, and also it's going to be very, very important. It's who are you going to send to that workshop? Because there will be a training, there will be a lot of discussion among countries. So it's an excellent opportunity for countries to decide who can be that person. Is it going to be the same one that deals with HRH issues? Is it going to be a person that deals just with the statistics and data collection? So, and that goes to the agenda item that, as it was established, it was identification of the focal points for the NHWA platform. And regarding the last questions, which is also very, very important, about having the health information systems and having the NHWA platform. Both are different things that support each other. So it doesn't mean that the NHWA is going to replace the health information systems in HRH of the country, not at all. It's going to support it. So it's a parallel process, as I see it, that we need to continue developing the national health information system in HRH in one way, and providing data to the NHWA. By providing data, you're thinking about indicators, how to build them, how to gather data, and that's going to strengthen the health information system. That's how I see it, and that's what I would recommend. Continue building, continue strengthening your national health information systems in HRH, and continue supporting and uploading data into the NHWA. Over to you, Madam Chair.
Thank you very much, Dr. Puertas, for those clarification with regards to the interoperability of the system. We also have a question from CNO Smith. Please go ahead, CNO.
Thank you, Madam Chair. And thank you, Dr. Puertas, for that clarification, especially with respect to the two systems, the National Health Information System and how it relates to the NHWA. I say that because I have been the focal point for the NHWA for Antigua, and I must confess that I have not really been consistently inputting data, and it's mainly because of my very busy schedule. And so I would request that Antigua and Barbuda be considered for country-specific support with respect to training and retraining. We recently had somebody who completed a master's in, I think, human resource management. And I've had discussions with her about her assuming the focal for the NHWA, but she of course would require training. I believe that she is responsible for the human resource management for the Ministry of Health. But as Dr. Porter's explained, that both systems are not the same, but they can be and should be be supported or be implemented in a parallel fashion. So, my main comment is that I'd like for Antigua and Barbuda to be included for country-specific training with respect to the implementation of the NHWA. And I hope that that support could be realized very soon so that we could begin to really manage our system in a consistent manner. Thank you. Over.
Thank you, CNO Smith. We have Dr. Acuna and then the Dr. Moxley from the Bahamas.
Thank you, Chair. I just wanted to add to what Dr. Portas was commenting on the importance of regarding both sources of information as valuable tools for decision-making and also complementary tools. There is an important piece of information that the National Health Workers Account provides for policies that are directed at countries to collaborate, to help each other, and to exchange information regarding the mobility of healthcare workers, for instance. And so what we need is for the countries not only to have their own national systems for their inside information and to make decisions at national level, but also to exchange informations and to share information with others so they can help each other with issues that cannot be solved by just one country at national level, but need to be solved by countries collaborating with each other, such as the mobility of healthcare workers. So that is why the National Health Workers Account is so important. So we can have the information of all the countries and we can bridge the information so those countries can talk to each other and can share not only the problems, but also the solutions to the problems we're facing with the healthcare workers, not only in the sub-regional Caribbean region, but also in other countries of the region and also of the world. So that is why it is so important to have both sources of information and also to consider that this information is not only for internal consumption and policymaking of the countries, but also to share with other countries. Over to you.
Thank you, Dr. Acuna. Please go ahead, Dr. Moxley, sorry.
Thank you again, Chair, for allowing me the floor. I just wanted to clarify Dr. Puerta's response. So our health information system is something separate and apart from HR specific platforms that we have in country. And in fact, we are transitioning from one HR information system to another HR information system. And just wanted to ensure that with that added insight, if the response remains the same. So I'm understanding that the NHWA is interoperable with other systems, but just to ensure that the response about the two being complementary to each other still stands. Over. Thank you so much.
Can I jump now, Madam Chair?
Sure, go ahead, Dr. Puertas.
No, I think the discussion is really, really interesting. And what perhaps we should think for the next meeting is to have one agenda item to move on this particular item, I think. But anyway, so how I see the platform, the NHWA, it's a platform created for countries to share their information on human resources for health. Originally, we had about 84 indicators in that platform, just HRH indicators, and now they're changing that number and making some adjustments, and that's something that will be discussed and presented during the Panama workshop. The Caribbean, looking into those indicators, realized that it was impossible to upload that information requested in the NHWA. And that's why the Commission identified those indicators by priority in 3 different levels, as you will recall, and identified only 34 that were the most relevant to the current situation in the Caribbean. And again, divided by levels. So you see, that's something that came out of the region. It didn't touch the health information systems at the national level. What it does is it's a way of providing feedback on how strong is your health information system. Because if it requests X or Y indicator, you go back to your own health information system and you see, okay, do we collect this data? And then you realize that you may or may not do that. And that's how we came out choosing those 34 indicators, because of the possibility, the real possibility of collecting those data. So again, they are complementary. If the Bahamas decides to move to a different health information system or software, you are completely free to do so. And it doesn't mean that it's going to be interoperable with the NHWA platform, because it doesn't work like that. It's just a platform where you collect data and upload it there. And then you realize also, that's the feedback I'm talking about, what information you're able to provide and which one you don't. And you see the need and the importance of collecting certain information for decision making. And that's what Dr. Acuna was mentioning, because that's the main objective, to be able to provide the right information for decision makers who are going to be working in policy, national policy. I hope that clarifies a bit more what's my position about this. Over to you, Madam Chair. Thank you.
Yes, thank you very much, Dr. Puertas. In Belize, we are currently engaging in a new health information system specifically for HR. So we are in the pilot phase, but what we have done, we have looked at the different indicators that we also need to report on to update the NHWA, and we try to integrate those key indicators and the need for those data within our system. Our system, we require additional information that we need due to the way we manage human resources. So that system is helping us to be able to provide a mechanism for management of this HRH data that we are required, and also for our the key indicators that we agreed upon as a Caribbean region. It is just in its early phases, so we are seeing the different bottlenecks that we are having in collecting the data and updating the system. However, because it's something that is homegrown with, and it was developed within the ministry, we are able to adjust it as we go along. And then with regards to the training for particular needs of the country, I do understand and the sentiments of the other countries that we do have high turnover of staff within different ministries and the need for constant training. So what we have done here in Belize, we have decided to expand the training to not only Ministry of Health, but also to our partners who have integral role to play when it comes to human resources. For example, our Nurses and Midwives Council. So we have our registrar engaged in the training. We also have our registrar for the Medical and Dental Council engaged in the training, and also for pharmacy and laboratory and different allied health professionals. So that is the way we are going to be able to have, we believe, some consistency as it relates to the training and the capacity in the NHWA. I noticed that CNO Smith has her hand up. I'm not sure if it's a legacy hand or she has another comment. If so, please proceed, CNO Smith.
Yeah, just a follow-up to my comments earlier. I believe Dr. Puertas mentioned earlier that there was going to be a meeting in Panama in I believe September, and that persons from this commission and I think the NHWA focal points would be the participants of such a meeting. I was just wondering, because I don't know if my ministry has received an invitation, but Antigua, I was just wondering if invitations have already been sent out, because I'm not aware that one was sent for Antigua and Barbuda. And if so, then I'll probably have to check with my permanent secretary. Is that the case? Over, thanks.
Thank you very much, CNO Smith. I will double check with the country office, in this case, the ECC PAHO office in Barbados, to confirm if the invitations were already sent, because the procedure is that from my office in Washington, we send the invitations to the countries, but via our country offices. So in the case of Antigua and Barbuda, that is the ECC office in Barbados, and that's where the invitation should have come from. So please double check with your from your side, and I will double check with Barbados country office to find out in which stage is this invitation. But again, you know, we really hope that we have all the countries represented in that meeting in Panama. You see the amount of discussion we have had in this short meeting. We have used a good portion of it. So it's something that countries are really looking forward. And that's why we have this very important workshop coming up in September. So I will be checking with our country office. Over to you.
Thank you, Dr. Puertas.
Okay, so thank you all very much for the this very fruitful discussion surrounding the NWHA, and I am sure that with the training and with the upcoming meeting, we will be able to have some improvements and advancement with the collection of our data, and also enhancing our health information systems for human resources at our different country level. So if there is no other business, if anyone, I don't think anyone has any other business to present. We move to item 11, the date of the next meeting. The meetings are normally every quarter. So it would be in November, the next meeting. And it seems that on Wednesdays is a good day. We notice we have a very good participation today, which is much appreciated. So we could probably schedule the next meeting for the 22nd of November, if that is okay, Dr. Bender.
That lady died.
Hi, good. Hi, Chair.
Excuse me, Dr. Bender. We have CNO Edwards. Would you kindly mute your mic, please? Or if the host can mute her, please.
Yeah, okay.
Thank you. Kindly proceed, Dr. Bender, or
See, Fiona has her hand up. I don't know if she wants to say something beforehand.
okay, sure. Miss Fiona?
Yes, thank you, Ms. Bell. Usually the meetings are on the second Wednesday of the in the quarter. So, and this quarter we were a bit early. It should have been in September. So I don't know if we want to stick to the usual schedule and do it in December, perhaps on the, let me just see, on the 13th of December.
Miss Fiona, I don't know about the other members, but I would recommend we would do it in November because in December, many persons would normally take leave during that period of time. And so we may not have the participation that we expect.
Okay. So then it would be the second Wednesday in November. Would that be okay?
I think Dr. Portis has his hand up.
In November, there is the training there in Chicago as was presented by Dr. Puertas. I am not sure the exact date. Dr. Puertas, please.
Thank you very much. Actually, let me double check on the meeting in the meeting for the expanding roles, education and regulation of nurses in primary health care in the Caribbean. It's going to be held in Chicago on the 1st and 2nd of November, 2023. And I also prefer, if I may say, the meeting in November for a reason, which is we need to see how the implementation of the activities related to the WHO Catalytic Fund is moving on in the Caribbean. So I think it's going to be a good moment to discuss if we do it in the second Wednesday of November compared to late in December. Over to you.
Okay, thank you very much, Dr. Puertas, for that. So we recommend the 8th of November as the second Wednesday of November for our next meeting.
Okay, it's noted, Chair. So we are set for the 8th of November,
Sorry.
2023.
Yes.
Okay, thank you. Noted.
Okay, thank you very much, Dr. Bender. And I'd like to take this opportunity to thank the Secretariat, Dr. Bender, Miss Fiona, also Pan American Health Organization, Dr. Puertas, who has always been supporting the commission, and also as the person who has assisted us in moving the task force into a commission. We appreciate your efforts, Dr. Puertas, and your colleagues and team at the Pan American Health Organization. And we look forward to the continued support, and we also would like to thank each and every country representative here today and for your contribution in this meeting. And we will also be sending out from the Secretariat for countries to update their representatives of the commission, as well as the focal points for their NWEG going forward. So we are just in time as per agenda. So thank you all very much and continue to have a pleasant day.
I have my hand. I just want to ask a question, Stacey, during Minister of Health Barbados.
Sure, go ahead.
I may have missed it because I was a bit distracted with another activity here. My apologies. But I just want to get the conclusion for the training in the National Health Workforce account. What was the decision there?
Okay, with regards to the training, it seems that it is going to be one where each country requests their respective training based on their respective needs. So that can be done through your PAHO offices in country.
Okay, okay, thank you.
You're welcome. So thank thank you all very much and have a pleasant rest of your day.
Thank you. Have a good day.
Okay, bye. Have a
Thank
good
you.
day.
Have a
Thank
good
you.
day.
Bye.
Thank you very much.
Bye-bye.
Thank
Thank
you.
you.
Have a
Bye-bye.
good day.
Fiona, good afternoon. Just to say, once the recording is available, could you please share so that we can take note of all of the decisions or actions that were asked? Thank you. Hold on.